Hello guys, it's your girl Annie from Med School Life coming to you for part 2, day 27 of our Q&A. Now, in the previous video, I talked about the importance of understanding electrolytes and electrolyte balance in the body. Today is topic number 2, which is constipation. Okay, so I had a question from one of my subscribers who said, listen, I would take my whatever except my iron, my vitamins, whatever, but I get constipated. And I don't like that. I'm like, okay, I understand. I know how things work in the body. So, what my suggestion is, here it is. If you are taking calcium, which can constipate, or medication like an opioid, they cause constipation. You can incorporate magnesium, a magnesium pill, into your regimen. What I would start out with is you take your magnesium before you take your medication, okay? And because you got to take your medication every day. So you just incorporate your magnesium either every day or every other day. I would start every other day and see if that relieves the symptoms. The other thing that you have to do is water. Water will help. It will flush. It will keep your GI tract lubricated, and you will be able to go, relieve yourself. And I'm hoping that, that helps more people stay on their regimen. There are medications that cause side effects, and that's why I'm always saying, no matter what the side effect is, please go and talk to your physician about it, because they can tell you exactly what to do regarding your medication and how to relieve those side effects. They can prescribe a combination therapy. They may be able to lower the dose, so you can talk to them. It's individual. Every person is unique, and I talk about being unique in my other videos and what that means in terms of your eating program, your exercise program. Nothing is a blanket. And I mean, whenever you want to follow someone or listen to what they're saying about training and fitness and nutrition, it has to be customized. What would happen if someone walked into my office and I just had a drug and I just gave it to everybody? That just wouldn't work well. Every patient I see is an individual. I'm treating that person, not the ill. I'm treating the person, not the illness. Okay? And I think that's what's important when you go and see these trainers who want to train people in, listen, God love them, but they have to understand that things have to be customized. Okay, I'm gonna leave it at that. Okay, so the next topic is, how do I stay motivated? All right, the first thing I think is, you're not gonna always be motivated. No. There are gonna be days when you're not motivated. But here is what separates the people who give up from the people who press forward. The people that press forward made a commitment to themselves, and they made themselves a priority number one. When you can do that, you will get up regardless. You will get out regardless. If you haven't done that, you're still relying on motivation. No. I made a commitment to myself to get in shape, to change my life, not to worry about weight loss, because, and let me just say this. There are out of shape thin people. They cannot do a lot of things, even though they look great in clothes. They're tiny, they're not fit. And then you have big people that are fit. They're fit, they go hiking, they row, they canoe, they swim, I mean, they just have a really good cardiovascular system. Their heart is strong. They're oxygenating their tissues. They have great perfusion. So what I'm saying is this: get strong, get fit. Get fit for your body. Walking uphill, downhill, daily, you know, being able to keep your eating program here, but raising your activity level. You can surpass your caloric intake. That's why I tell people, don't change your eating plan right away. Don't do it, because you may, let me say it this way, you may be eating the right calorie count at the point you increase your intake. I mean, your activity. You understand what I'm saying? And if you decrease your calories before you maximize your activity, now you're out of whack. You're out of balance. So that's why I say leave your food alone. Leave your food alone. This, week 5, we're going to deal with food. We're going to talk about substituting. Okay, you eating cakes, cookies, and pies. All right, you belong to the CCP club just like I did. CCP, cake, cookies, and pies. Or maybe you belong to the SRP club, steak, rice, and potatoes, So whatever club you belong to, it's just about substituting. You're not going to feel deprived, because the truth is, the more you work out, the more calories you're going to have to consume. Carbs are not the devil. You need carbs, you need fats, you need protein. It's just you can't eat a lot of protein. You're not a bodybuilder. If you're a regular person, you need just my fist, your fist. That's about the amount of protein. And then the rest is vegetables. But we're going to talk about food. You're gonna see my plate in a couple more videos. But I'm hoping that these topics were a help to you. I enjoy doing them. I'm going to look forward to our next Q&A. And remember, now you have information from these 2 videos on electrolytes, okay? How to relieve constipation when you're taking your vitamins or prescribed medication. And make sure you go back and speak with your doctor. And how to stay in the game beyond when motivation leaves you. It's all about commitment. It's all about consistency. Those are your tools, okay? And gravity is our personal trainer. This your girl Annie from Med School Life. Stick with me. Stick with me, because I'm going to stick with you. All right, guys. Bye.